My name is Dr. Bashey, and I'm a board-certified dermatologist, and it's my pleasure today to welcome you to a webinar on anti-aging protocols and practice. And we have a great webinar set up for you guys today. If you want to follow me on Instagram, my handle is @DrBashey. And as always, we at ZO, we love hearing from you. We love hearing your feedback. And if you have any questions, we'd love to answer them. Thank you so much. So let's talk a little bit about why bothering with anti-aging anyway. And I think the key point that we want to make in this presentation is that aging skin is vulnerable skin. We often think about anti-aging simply as a vanity thing, a cosmetic or an aesthetic issue. But what I want to really explain to you is that if your skin is healthy, then the chances of you getting skin cancer, the chances of you getting intrinsic and extrinsic aging, this process is really reversed and held back. And the purpose of anti-aging is really utilizing key ingredients: retinol, retin A, antioxidants, growth factors, vitamin C. And the purpose of this, like I mentioned, is to hold back the inflammatory process that occurs in our skin from intrinsic and extrinsic factors. These inflammatory factors will end up causing aging, but ultimately will make our skin vulnerable to skin cancer and other things. Let's take a minute and let's talk a little bit about skin cancer in general. We should know that skin cancer is the #1 most common cause of cancer in the United States. And this is something that we see again and again and again because we're living in a population where we now understand that sunscreen helps prevent skin cancer and that sunlight causes skin cancer, yet we are seeing alarming rates of basal cell carcinoma, melanoma, and squamous cell carcinoma. Basal cell, for example, we see 4 million cases every year diagnosed in the United States alone, and this is amounting to billions and billions of dollars. So one thing we want to keep in the back of our mind is, we want to help our patients, but we want to keep them healthy as well. So we want to respond to their cosmetic and aesthetic needs, but we also want to make sure we are doing good by their skin health. And that's what we're pushing. That's what we're pushing here with this presentation. What I want you guys to understand is that healthy skin is skin that is not vulnerable. Now, let's talk a little bit about the inflammatory process that occurs in the skin and elsewhere in the body, but we're going to take a focus here primarily on the skin. Whenever something happens to the body, there's a process known as acute inflammation that occurs. Usually there's some sort of injury, and acute inflammation is characterized by an injury or some sort of traumatic event. And there's a rise, there's a call into the area of the inflammatory cells, such as neutrophils and things like that. And a process occurs whereby a problem is identified, inflammatory cells are recruited, and then that inflammation process ends and the inflammatory cells leave. That tissue is now healed, it's now stronger, and it's able to perform its normal activity. Chronic inflammation is a process that starts acutely but then does not end. Instead of simply having a start and a stop sequence, this process has a start sequence and then it just keeps going and going and going and going. And what we have to understand is that the cells that we recruit in an inflammatory process are powerful. They contain cytokines, they contain enzymes, they contain chemicals that are designed to break down tissue, break down bacteria, viruses, and fungus. We can only have these cells activated for a set amount of time. If these cells keep going and going and going and get activated without shutting down, we have a chronic inflammatory process. And in the skin, when we have a chronic inflammatory process, we are talking about intrinsic aging, we are talking about the production of wrinkles, texture damage, and eventually skin cancer. So the purpose is we want to create acute inflammation. We want to get rid of chronic inflammation. Chronic inflammation is bad, and healthy skin is not chronically inflamed. The process of all inflammation, including inflammation in the body, occurs through a free radical formation. And when we think about what a free radical is, it's basically an unpaired electron. And when we think about what makes molecules stable or unstable, stable molecules have all their electrons paired. An unstable molecule has its electron unpaired. So when we think about, for example, the free radicals in the body, when we think about the end product of an inflammatory process, especially that of a chronic inflammatory process, we are looking at something called a reactive oxygen species, something we abbreviate ROS. What that is basically an unstable, unbound oxygen molecule. Because in our body, oxygen is always bound. It's either in the form of oxygen itself, which we breathe, which is dissolved as a gas in our blood, which is O2, or it's bound to hydrogen in the form of water, H2O. Anytime you have an oxygen molecule that is unbound, it is now unstable, and that unstable molecule is known as a free radical. That is the inciting factor which damages tissue. Healthy cells are cells that are able to balance the free radicals with basically things that reduce oxidative stress. Cells that are attacked by free radicals eventually get destroyed. And it's because the free radicals overwhelm the cellular machinery to basically fight off the injury caused by the free radical destruction. We're talking about molecules destroying molecules at a microscopic level. But at the macroscopic level, what that does is it creates an unhealthy skin that ends up being aging. Now, one of the things that we should talk about is essentially how collagen breaks down. Because when we look at free radicals, we're looking at a very, very microscopic level, but we want to think about this in terms of a bigger picture. We want to think about this in terms of collagen, right? Because the more collagen we have in the dermis, the thicker the skin, the healthier the skin. Eventually, the free radical formation, eventually this damage is conducted by enzymes. And these enzymes are called MMPs, matrix metalloproteinases. And what these enzymes do is these enzymes actually break down collagen and elastin. They take that triple helix strand of collagen and they literally break it down into its individual parts. What we want is we want to reduce the MMPs in the dermis. We want this enzyme to be controlled because, as you can tell by the name, it has the word protein ACE. And ACE is an enzyme that breaks something down, and this is breaking down protein, specifically the proteins that are holding the collagen bonds together. Eventually, what we want to talk about is that when we have something that's chronically inflamed in the skin, eventually we are now dysregulating the immune system in that area, and that's what chronic inflammation is. If you think about what we just mentioned a few slides ago, we talked about in an acute inflammatory process, the cells of the immune system come there, they release their enzymes, they create an issue, they break down that issue, they then leave, and the cells are now functioning normally. But in a chronic inflammatory state, those immune system cells never leave. They just stay there. They stay there and stay there and stay there, and they keep releasing these proteolytic enzymes that break down tissue. So essentially what they are doing, they're fighting a problem, and the collateral damage is healthy tissue. And that's what's occurring in this chronic inflammatory process. Eventually, we have a complete cycle of immune dysregulation that creates barrier dysfunction. Because again, if we're talking about collateral damage of the skin cells, now the skin cannot do what it's supposed to do, which is protect you. So we're talking about more infections from the outside world, more sun damage in the form of UV rays. Now your cells are even more vulnerable than they are before. So you have to think of this as not a process that's occurring in a vacuum. You have to think of this as a cycle of dysregulation that definitely needs to be broken. And we break that cycle by introducing the correct skincare products and behavioral practices that ultimately lead to healthy skin. Now, this is something that we as dermatologists understand. This is something that now even we are pushing to the public for the last 15, 20 years to understand that the sun is a form of extrinsic aging. The intrinsic aging is a process that occurs inside our body through free radical formation and chronic inflammation. But I want to hone in on why ZO is superior. What makes us superior? Now, we have identified key elements, right? As dermatologists, we have identified key elements, antioxidants, key ingredients, and products that are going to help the skin fight off what we just talked about. But it's not just about using these products, right? Because if you use the right ingredient, but that ingredient cannot get delivered to the tissue it needs to get to, then essentially you're putting on something on the skin that's not doing anything. You're basically shooting a blank bullet with your gun. So what differentiates us is key technologies, proprietary blends that combine the correct combination of antioxidants and immune dysregulatory suppressing things, suppressing chemicals and chemokines in a delivery process that is very, very beneficial to the cell. And, you know, something that I've talked a lot about on my social media is sometimes this is difficult to understand, right? What separates one technology and delivery system from another? And the best way to think about this is imagine you order pizza, okay? And you're ordering delivery pizza. You want the pizza delivered to your house, right? You're expecting 8 slices when that pizza gets to you. Now, imagine you order that delivery and you get only 2 slices, right? You're going to be disappointed, right? You now only have 2 slices to eat. You wanted 8 slices to eat. The delivery system and technology with skincare is very much like that. What is said is an ingredient is not often what gets to where it needs to go in the active form. And that's where the delivery is paramount. The delivery is key, right? The combination of the ingredients, the complexes, and delivery is very, very key. So what I want to focus on is the technologies that we have here at ZO, ZOX12, Z Pro, other technologies, but also understanding the packaging of these technologies so that they get to where they need to go in the right quantity, right? You want all 8 of those pizza slices to get to your door. Otherwise, you're going to be hungry. Similarly, the skin cells are not going to be getting what they need to get unless you package the retin-A properly, unless you package the vitamin C and E and collagen and HA boosters properly, or the anti-inflammatory modulators properly. And that's the key thing that I want to make you understand. So much of the technology and delivery systems that we push at ZO, this is essentially what differentiates us as a brand. We are very, very focused on the science of everything at the macroscopic and microscopic level, okay? Now, let's talk a little bit about the problem. We hit on this a little earlier. Our essential issue is aging skin, and I hope so far I've convinced you that aging skin is vulnerable skin, and that skin that's aged is more vulnerable to skin cancer, right? And so these things are all connected. Intrinsic aging is the aging that occurs from within us, from inside, right? So this is based on how your body processes sugar, how your body, undergoes oxidative stress, and how it deals with that oxidative stress. What cell pathways are responsible for repair? How much collagen cycling do you occurs in your skin cells, right? Whether you, for example, have a system of getting rid of those reactive oxygen species that other people just do not, right? And a lot of this is determined by your genetics, right? To a certain extent, a lot of intrinsic aging cannot be controlled because we are born with these repair mechanisms, right? We are born with certain benefits, and other people, for example, don't have these repair mechanisms to the same extent. Extrinsic aging is the aging that occurs from outside of us, right? And one thing I want to talk on is a little bit about the combination, right? So we have pure intrinsic aging, which is largely genetic, and then we have extrinsic aging, which occurs from outside. And then I'm going to talk a little bit about kind of like an overlap in that Venn diagram. Extrinsic aging is aging that occurs from outside. So it's largely determined by your lifestyle choices, right? So if you're sun tanning or you're getting a lot of, you go into a tanning bed or getting a lot of sun, or let's say you smoke, for example, right? A lot of that is extrinsic aging. A lot of that are things that you are doing that are promoting the aging process faster. Maybe you're not using sunscreen, so on. But there is this kind of barrier that is kind of like a combination extrinsic and intrinsic, right? So for example, smoking is kind of an extrinsic behavior, right? In the sense that you decide to smoke. But a lot of the damage that occurs from smoking is intrinsic, right? Because a lot of that damage is occurring at the cellular level from a lot of the chemicals that are in smoke. Extrinsic aging, another example, is pollution. If you live in a very polluted area, that's another example. Diabetes or a very high sugar content is an example of kind of like a both, right? Because extrinsically we decide to eat, but intrinsically a lot of that sugar, those what we call advanced glycosylation end products, are damaging the cell. So there is some overlap, but I want kind of people to understand intrinsic is largely genetically driven and determined. Extrinsic is largely environmental, but there is a degree of overlap. Both these factors are going to contribute to skin that is aging. Now, what is the solution? The solution is we need to repair the skin, we need to restructure the skin, and we need to use active growth factors. We need to use the right ingredients in the right quantities with the right technology and the right delivery. And that's what we're talking about here at CEO, okay? What we need to do is essentially stimulate skin. We need to stimulate skin, and we need to basically teach skin how to get rid of that chronic inflammatory cycle and upregulate positive epidermal and dermal collagen building molecules and substrates, right? Because ultimately, when we do that, we create a better essential dermis that's stronger, that's more hydrated, that's able to tolerate the collateral damage better. That's what we're doing, right? So ultimately, that's improving hydration, elasticity, and firmness, and it's trying to get rid of a lot of those other things that we see as skin gets aged. And if we look at the bottom, right-hand corner here, or my bottom right-hand corner, we can see what's happening over the course of a 10-year period, right? We see the matrix that builds that dermis and subcutaneous tissue disintegrate. We see dehydration, and ultimately we see the collapse of the skin due to lack of hyaluronic acid and volume loss. And that is the process that we're trying to avoid. A lot of what we're trying to do is stabilize as well, okay? So we want to stimulate, we also want to stabilize. And by stabilization, we're trying to promote the body's regulation of fighting the environmental and intrinsic damage in a better, more efficacious manner. And we want to do that through all levels of the skin, the epidermis and the dermis, and to a certain extent the subcutaneous tissue, right? And this is why the penetration of products and the active ingredients are very important. Because look, if you look at this diagram, you're looking at a 3D structure of the skin and subcutaneous tissue. You have to understand, the epidermis is composed of several layers, right? These layers are designed to protect you against the environment, but these same layers also decrease the penetrative activity of products applied on the skin. So if you have the stratum corneum all the way to the stratum basalis, and then you have the dermis, and like we showed in the prior slide, much of the matrix that occurs supporting the dermis is occurring in the deeper part of the dermis. Now you have to understand how important it is to get products penetrated. And that's the focus, right? So stabilization, stimulation is what we're talking about. Now, let's take a minute and let's go through a couple of the products that I feel in our line of products are excellent products that really push back the aging process and really, at the same time, protect the skin, increase the safety of the skin, okay? So we're going to talk about a number of different products, and what I really liked about this webinar is Leo has given me the opportunity to really talk about my experience with the product. It's given me a chance to really talk about my protocols and really as a dermatologist, my background in terms of how I see the science of this all really coming together. The first thing you have to understand is your patients are going to ask you, well, why do I have to do getting skin ready? Why is this an essential step? And I want to bring you back to the slide we talked about before. We have several layers of the epidermis. On top of that dead skin cell layer known as the stratum corneum, we have oils, we have makeup, we have leftover sunscreen, we have pollution, we have the smog that we're walking around in, like I am in Los Angeles, for example, right? We have debris, we have all of these things that are sitting on the skin. So even before products get penetrated into the dermis, even before they can get into the bottom layer of the epidermis, or the epidermis themselves, those products have to go through all of this gunk, plus the dead skin cell layer, to even penetrate the epidermis. which is why the getting skin ready is so crucial. The washing, all of the dirt, the oils, the sebum, the debris, the makeup, the pollution off the skin. Then the degreasing of the sebum, because sebum is very strong and counteracts the application of all of these products. But also, we should understand that sebum is also highly inflammatory, right? Sebum is something that, in my opinion, and this is something I learned from Dr. Bashey, and I'll take a little evolutionary biology aside on this. Sebum is something that helped us when we were primates. We had hair all over our bodies. We need to lubricate that hair. That's where the sebum came in and was very, very helpful. Now, as we've grown into becoming the humans that we are today, we've lost all of that hair, that facial hair, that neck hair, etc. We've left over the sebaceous glands as vestigial structures, much like the appendix is a vestigial structure. So the washing, the scrubbing, and the oil control is really about controlling oil. It's about controlling the sebum. It's about controlling all those dead skin cells and pollution so that we can penetrate products effectively into the skin cell and counteract the effect of oil, because oil is going to actually neutralize a lot of what we put in, okay? So getting skin ready is the vital step to decrease the chronic inflammatory process and getting products into the skin. Now, we're going to go one by one, and I'm going to go through a little bit about the product individually, and then I'm going to come back and tie in later on with these products how they can be used clinically and what the protocols are, and really my experience with them. But we're going to start with really kind of more the nits and gritty of the products themselves. Vitamin C, 10% self-activating, wonderful product. And we have to understand that vitamin C is a very, very potent antioxidant in the human body, beyond skin, but even in the skin, very, very potent. And it depends, if we go back and we talk about the antioxidant role of vitamin C, not only does it protect against reactive oxygen species, it protects against oxidative stress. Vitamin C acts in two places. Vitamin C stabilizes the melanocyte, and vitamin C is crucial as a cofactor in the triple helix collagen formation process, right? So if we remember the way collagen forms, collagen is a bundle, the way your skeletal muscle is a bundle, right? And collagen is essentially the building blocks of the dermis. It is the building block of the dermis. This ultimate product is what we are trying to create, right? Now, collagen is formed by a combination of amino acids, right? Proline, hydroxyproline. And these individual subunits by themselves cannot form a collagen fiber or bundle. This process occurs via the enzymatic coagulation of multiple procollagen subunits into a triple helix. And this process requires vitamin C as a cofactor. So if you lack vitamin C completely, right, and you cannot form these collagen bundles at all, this was a disease that was actually incurable several hundred years ago, known as scurvy. Now we understand the process of the collagen triple helix formation, and we understand why we need vitamin C, right? So in the past, what was given to those people, they were given orange juice, they were given lemons and limes. We are beyond that now. We now understand the whole process of how vitamin C is crucial to triple helix collagen formation, right? The organization of collagen is like a meshwork. And this meshwork, if you look at this diagram that I have on my left-hand side of the screen, you can see that these fibrils are not just arranged in linear order. They are cross-linked. And that cross-linking of these fibrils is what gives the dermis its volume, In between these cross-linked collagen fibrils, we have glycosaminoglycans, also known as hyaluronic acid, right? These products absorb 1,000 times their weight in water. So in between these triple helixes, we have a glycosaminoglycan. That creates a sponge. That creates a buoyant structure that's able to tolerate trauma, able to give support and structure. So these molecules are critical to giving the skin its structure and support. Now, if we look at the histological specimen on the right-hand side of my screen, these large red cylindrical structures that are cut in cross-section in different ways. When you see it on far, you can see it looks like a muscle fiber, and then if you see it cut sideways, it looks like a linear structure. Those are the collagen fibers. The white in between them is the glycosaminoglycan or a hyaluronic acid. That stains white on an H&E. You can stain it specifically, and you can make it stain light blue if you'd like, if you use the correct stain. But when we look at it histologically, we want to think of this, that's not just artifact, that's not just nothing. In between there is actual glycosaminoglycan, also known as hyaluronic acid, okay? Now, let's move on to daily power dispense. Daily power dispense is, in my opinion, one of the crucial products in the ZO Skin Health Armament. And that's because this product contains a hint of retinol, but also is filled with antioxidants. And the reason that I'm so in love with the antioxidants is because we need to understand aging in terms of the microscopic diagrams and processes that we talked about earlier, right? So daily power defense is working primarily at the antioxidant level to stop free radical damage. And this intrinsic process is retarding the aging process. That's what I'm trying to say. And it's by promotion of the antioxidants which bind the free radicals, okay? That reactive oxygen species that's by itself, it needs something to antagonize that. That's where the word antioxidant comes from. That's what this product is doing. Now, if we think about that process, okay, that inflammatory process at the DNA level, we talked about it at the cellular level before, but we didn't talk about it at the DNA level. Here we have the double helix structure of Watson and Crick of the DNA, right? We've got your molecules, your nitrogenous bases that pair with each other, AT and CG. This is high school biology, right? This DNA is constantly being damaged every day in the form of extrinsic and intrinsic processes. Now, fortunately for us, we have mechanisms within ourselves to ensure the integrity of the DNA, ensure the integrity that these correct base structures are paired with each other and not improperly paired. And we have repair mechanisms. But over time, the DNA damage in the form of extrinsic and intrinsic processes damage the DNA structure, mess up the parent. And this DNA damage is eventually what contributes to a single cell that's able to grow faster than other cells without any form of being checked. That's the precursor cell to a monoclonal cell line that causes skin cancer. That's why the products that help fight free radicals and decrease DNA damage are extremely important. Because it is at the microscopic level within the nucleus of the cell that DNA damage is occurring. Okay? Here's the science behind all of this, and that's what I'm trying to talk about. That's what I'm trying to push so people understand. Now, let's take a step back and let's talk a little bit about the Ferming serum. We talked briefly before, a few slides ago, about the structure of the dermis, having both the collagen and the glycosaminoglycan in between them. Ferming serum is a serum, and I was part of the pilot study that demonstrated the amazing results of this product. So, this study was conducted in clinic with my patients, and I presented this data. We've analyzed the data, statistically significant. Ferming serum is in my opinion, a multimodality product that helps fight a lot of different skin issues. Of course, it firms and tightens skin, and that's what it's for. But it also supports the structural integrity of the skin and fights against free radical damage. So in that respect, it's acting as an antioxidant as well. Now, if we go back to the slide we talked about earlier, and we now compare this to the slide here, where we look at the dermis again, and we see the combination of the collagen, the elastin fibrils, and the glycosaminoglycans, we can see at the level that firming serum works and how it actually firms the skin. It's firming the skin by activating the fibroblasts that are making glycosaminoglycans. Now the science of this should make a lot of sense, right? By activating the fibroblasts, by producing collagen and glycosaminoglycans, we are improving the structural integrity of that sponge that holds the skin together. That matrix, that combination, that structure, that buoyant structure, that's how this product is working. That translates to macroscopic or clinical results that we can see. Now, growth factor serum. I really like this product, and I use this product in both maintenance phases and when I'm trying to actually fix something, when I'm trying to actually attack a particular problem. Growth factors are something that you're going to see more and more. And the reason you're going to see more growth factors is because we want to harness these ingredients, and we want to take these ingredients and again decrease oxidative stress that cells are being constantly what they're undergoing. And this product takes a lot of factors, so I'm going to get back to this. This product takes a lot of plant-derived growth factors, which are very, very safe, which promote certain cellular functions that create collagen, that build hyaluronic acid, that improve glycosaminoglycans, and reduce inflammation. All of that translates to a less aged looking skin. Now, let's talk a little bit about wrinkle and texture repair. Up until this point, we have been primarily talking about antioxidants. We have been talking about vitamin C and its antioxidant role. We've been talking about retinol palmitate and its antioxidant role. We've been talking about certain enzymatic cofactors in their antioxidant role. Now we're going to be talking about the vitamin A and vitamin A derivatives. The heart of wrinkle and texture repair is its advanced retinol formulation. It has a 0.5% retinol formation, and retinol is a derivative of vitamin A. Vitamin A is one of the most crucial ingredients for skin cells. When we have vitamin A inside the skin cells, vitamin A goes into the nucleus and essentially at the DNA level binds to receptors. These are known as vitamin A receptors, and more professionally within our circles as dermatologists, retinoid receptors. There are retinoid receptors. There's various types of retinoid receptors, but these receptors create and bind with promotion and silencing molecules on the DNA. So we look back on that DNA, on the outside of that double helix are certain promoting and silencing elements. Vitamin A, once it gets to that level, promotes certain characteristics inside the skin cells that are necessary for the skin cell's survival and ability to thrive. I'll go through a few of those. One of those is basically what we call normalizing epidermal differentiation, which means the cell starts at the basal layer and eventually gets to the top, right? And it creates stability of the DNA during that process. The vitamin A teaches the cell to stabilize the melanocytes, so that color is stable. It acts as a potent antioxidant. It acts as an anti-inflammatory molecule. It acts as a collagen builder. And primarily, in my opinion, vitamin A is the most vital chemical to the skin cell. Retinol is a precursor to retin A, and retin A is a precursor to vitamin A. So it goes through an enzymatic process of changing. This is a high-potency retinol that gets inside the cell and does what it's supposed to do. It converts into retin A, and that retin A converts into vitamin A, binds the DNA, and then undergoes all of the enzymatic processes I just mentioned. Radical night repair is basically a formulation of 1% retinol. And again, now we are taking that retinol, which will eventually become retin A, which will eventually become vitamin A, and it will do all of the things the vitamin A needs to do inside the cell. And that's what we're seeing clinically, right? Clinically, we see this as improved brightness, reduction of brown spots, the reduction of fine lines and wrinkles, increase in volume, because we're getting vitamin A inside the cell, and vitamin A is ultimately doing what it needs to do. Now, let's take a brief moment and talk a little bit about sunscreen. If we go back to that original slide where we talked about the epidermis, sunscreen acts as a barrier between the outside world and your skin. And it acts as a barrier to UVA, UVB, and now high energy light, because we're getting a lot of this HEV light in the form of exposure to computer screens, tablets, phones, etc., right? The DNA damage in the form of UVB and UVA, primarily UVB, that occurs from the outside world creates that extrinsic aging pathway that creates chronic inflammation and eventually causes DNA damage. By putting a physical blocker on the skin, we are creating a physical barrier between the outside world and the skin, and that's what our sunscreen does. Our sunscreen is extremely, extremely potent, and I'm a big proponent of utilizing sunscreen, right? So if you think about it, right, GSR removes all the dirt, gunk, oil on the skin. GSR helps battle that sebum that neutralizes product. Then we put in our product, and at the very end, we put in sunscreen, locking that product in, protecting the skin and the product from the outside world. That's what we're doing here. We have a 12-hour release antioxidant complex in the sunscreen itself. So not only does the sunscreen help protect you in the form of its active ingredients, right? Its antioxidants are further protecting you against DNA damage. Now, what we're going to do is we want to make this clinically relevant. We want people to understand the relevance of this clinically. So I'm going to take a moment to go over a couple of clinical examples, a few clinical cases, and talk a little bit about how we utilize products, what protocols we use, and then hopefully this will really put everything into perspective. And again, the focus is on anti-aging here, but what you're going to see is a lot of secondary benefits when we utilize products to fight anti-aging, right? And the reason is when we are fighting the aging process, we are creating healthier skin, thereby promoting all of the cellular functions at their optimal level, which will include an improvement in skin color, an improvement in size, volume, et cetera, et cetera. So here we have, a lady on the elderly side, and she's coming in. We can see for her age, she's got PIH. She's got what looks like acid acne. And this is really rare, right? So she's got some sort of, looks like to me, obstructive acne on the forehead. But if you look at her chin, we see quite a bit of PIH, prior acne there in the past. There's maybe some combination of rosacea, acne rosacea of the cheeks. We can see that the skin tone is uneven. We can also see that the area around the nasolabial folds is quite volume depleted. The under eyes look sunken in. And we can see overall, we can see the jowls, even how the volume depletion, lack of firmness, fine lines and wrinkles around the eyes, right? We can see and appreciate those fine lines and wrinkles on the forehead even more. And the active picture, we can see that, it's apparent. Tone has been improved. There's even an improvement in volume. The jowls look better. The fine lines and wrinkles are gone. Some of that acne rosacea, overlap phenotype is also gone. So a remarkable improvement on anti-aging products alone. So what do we do for her? Her protocol is primarily based on something that's very simple. We added GSR, daily power defense, and growth factor serum. The way I used it was I had her do GSR morning and evening. I had her do daily power defense morning and evening. And I had her do growth factor serum to her face and neck at night. And then later on, as you can see, she got a little bit red from some of the retinal palmate in the Daily Power Defense. So we'd add on the Rosatrol to help her and decrease that. Again, I mentioned before I'm a big fan of growth factors serum, and I use this product primarily in maintenance protocols, but I've also started recently using it when I'm trying to even correct melasma and active rosacea and other things. And this redesigned formula is very versatile. It's very light. It can be used after radiofrequency needling or microneedling. I use it all the time because of the growth factors. Use it on the face, neck, and chest. You can use it after Clear and Brilliant. You can use it after light CO2 laser resurfacing. And it's really my go-to in almost every aging protocol. And that's because it's very well tolerated. It's a very, very rich product. And I really like using this in patients that are coming in. One of my tips is, if you have a patient coming in and they're skeptical of starting perhaps with a new skincare company, if they've been using, let's say, other less cheaper products in the past, or they've been with another company, I put them on this protocol. And that's because, to me, when someone uses growth factor serum, they are so enchanted by the richness of this product that after they use it, they never go back to anything else. There's not a product like this on the market. So, again, a very versatile product. Now, let's talk a little bit about how Daily Power Defense helps this lady. Daily Power Defense, because it has a weak form of retinol, can stabilize the skin extremely well, and people will respond to this extremely well. It will improve your texture and tone by stabilizing the melanocyte. But a couple of the other points that I want to improve is that this is an exceptionally good product to improve barrier function and protection. And when the barrier functions improve, we lose less what's called transepidermal water loss, which means the skin stays more hydrated. And by hydrating the skin more, remember, those glycosaminoglycans basically absorb about 1,000 times their weight in water. We see a lot of hydration, and consequently, we see an improvement in volume. There's a couple of other points I'd like to make. In my practice, if somebody cannot utilize this product consistently, I don't do a procedure on them. If they tell me they can't tolerate this product, I don't do a chemical peel on them or a laser on them or anything like that. And I will often use this product as a challenge to patients to determine their adherence to a routine before I laser them or do a peel on them. And that's because if you can't tolerate a weak form of Retin-A, trust me, your patient is not going to tolerate microneedling, they're not going to tolerate Clear and Brilliant, they're not going to tolerate any of that. So put them on this product a couple weeks, then go ahead and utilize those other procedures. Now, let's talk about this lady here, okay? We see a couple of problems right off the bat. Pigmentation is this lady's primary problem. We see some melasma on the forehead. We see some uneven tone on the rest of the face. It's possible we get melasma extending down to the temples. There's a certain amount of, she's good with volume, but we see certain volume depletion really around the mouth area, which is very common because gravity tends to bring down the skin. It tends to collect in that nasolabial fold, perioral area. So we see that. We see some early jowling. We see a lot of the uneven tone, mixed melasma type phenotype. And again, I'm not so married to calling something only melasma because it's seldom in real life that we see just one problem, right? To me, she has melasma on the forehead extending down, but we also see some significant degree of sun damage in the type of pigmentation and uneven tone. On the picture to my right, the after picture, we've only utilized on her this cream. That's it. We can see significant improvement in all of that, right? Texture, tone, melasma, firmness, jowls, the nasolabial fold. Let's talk a little bit about what we did for this lady. For this lady, we used one of my stabilizing routines. And in the stabilizing routine, I did not use hydroquinone. I did not use the product, for example, the pigment control brightening and pigment control blending cream on her. I realized that I needed to combine non-hydroquinone products that have anti-aging function with a lot of anti-aging products as well. So I combined essentially GSR, Daily Power Defense, with her. We added on vitamin C, and we also put this lady on wrinkle and texture repair. So we got all of the improvement in the functions that we wanted. The vitamin C here was able to stabilize the melanocyte, which we talked about, because the pigment controlling process also depends on vitamin C. We were able to stabilize her skin inflammatory process. We were able to increase more collagen through the vitamin pathway that we talked about, that acts as a cofactor for collagen building. And I was able to improve her quite a bit, you know. Now, there's some things that you should know about the vitamin C product. Number one, I tend to use it once a day. I separate its use from Daily Power Defense. A lot of people do that. I also used it, you know, in pregnancy because it's safe. We don't have any ingredients in there that's contraindicated in pregnancy. It works very well with non-H2 products and other VO products, but caution your patients, it does have a citrus-like smell. And in some people, it can irritate the skin initially, so you should let your patients know. But I wanted to show you this example because we can create a significant amount of improvement with the protocol we just talked about. Now, wrinkle and texture repair, great product, right? And for young patients, you have the option, like in this lady, you can use advanced radical night repair, you can use wrinkle and texture repair. It doesn't particularly matter. You can use either or. The point is that you want to get some degree of vitamin A inside the skin cells so that you can create all that improvement. And again, I want to tell people, from my experience, don't assume this is a weak product because it's not active retin A. You're going to get people who will peel from this product and advanced radical night repair. And start them off slow, please. Go 2 to 4 times a week, 2 pumps, use it at night. And it's really works very well with anti-aging protocols, like what we did on this lady. Now, you can substitute this with advanced radical night repair. You can substitute this with pure retin A, like Ortisa. It really depends on your patient, what you're trying to do, and how much you're trying to correct. Okay? Now, let's talk about this lady. When we look at her, she's young. Okay, we want to talk about that immediately. She's young. This lady is in her late 20s. Okay? And the reason I want to bring this up, you know, many of you looking at this will say, well, you know, it's just this anti-aging lecture, but, you know, you really presented to me one lady that's really old. They all want to kind of middle-aged and want to be a bit younger. And the point that I'm trying to make is that the aging process starts a lot earlier than you think, okay? It's starting in Caucasians in the 20s. So it's important that you understand that, and that's what I'm trying to show you here, right? Let's look at her before picture. Clearly, she's got acne, okay? We see that on the forehead. We see some of the acne scars on the chin, okay? But she's got a tone that's not the best. And she's got volume loss around the nasolabial fold. She has an early jowl on the left-hand side, right? She's sort of sunken in the submalar area. And we can see that early crashing down of a lot of that volume loss around the perioral area. Look at her after picture. No fillers, no Botox, no nothing. We've fixed the acne. We've improved her tone. We've improved her texture. We've gotten that forehead nice and smooth. But look at the degree of volume change we've done in the submalar area. Look at the degree of the volume change we've done underneath the eyes and around the mouth. Significant, okay? Now, let's talk a little bit about what we did for her. Well, we knew we had to put this girl on GSR because her skin is oily. But I knew I needed to do something a little bit stronger than just control her oil because, you know, with the GSR, because that would not be enough. And you had texture issues, right? So what did I add in? In her case, I added the exfoliation accelerator. Now, we didn't touch upon this product earlier, but I want to touch upon it now. Because a lot of your patients are going to be coming to you with oily skin and aged skin. So it's important that you understand that oil and sebum promotes the aging process by promoting the chronic inflammatory process. So although not a direct anti-aging product, okay? Although not a direct anti-aging product, This product will work with your anti-aging protocol by stripping the skin of all that extra sebum that is pro-inflammatory and creates aging, okay? 10% glycolic acid, safe for use. I use this in a lot of patients, primarily to decrease the oil, which will help me with my aging protocols. Use it whenever you have a texture issue. I sometimes double this and use it morning and evening. Don't really use this in patients with older patients with sensitive skin, and stop this product before peels and facials 3 to 5 days. So in the patient that I just showed you, I use GSR. I use exfoliation accelerator in the morning. Combine that with the daily power defense, morning and evening, and we use some Murphy's on her. So again, just to get an idea of what kind of change that you can do with these products. Okay, let's talk a little bit about this lady. Again, I want to show you, younger patient, uneven tone. We've got the acne. We've got some of those scars, right? Look at her chin. There's some degree of her picking at herself, right? Submalar volume loss, sunken in underneath the eyes, sunken in the temples. No melasma, but sun damage, right? And then we see again that crashing down of the volume loss around the mouth with the early jowling. Same thing. The point is, yes, a lot of my patients are young, but the point that I'm also trying to make is that you need to start recognizing the aging process is occurring in younger and younger and younger patients, as is the evidence of skin cancer in younger and younger patients, because the behaviors are changing. People are going out in the sun a lot. People are tanning. People are like on the beach. So we're seeing aging younger and younger and younger. So in this case, what did we do? Okay. Well, this lady, she had some issues with oil, not a ton. I knew I could get rid of a lot of her issues by doing GSR, but I knew that I needed to create some size. I knew I needed to create a lot of size for her. So what did we do? We added the anti-aging protocol in the form of GSR, daily power defense in the morning. We added firming serum morning and evening, and then we added growth factor serum. This was enough to improve this lady significantly. And we're able to create a lot of size. We're able to create a lot of, volume replenishment. And again, I want to point out the fact is that when you improve those glycosaminoglycans in the dermis, you create a lot of volume change, right? Not every patient needs your filler or Sculptra, right? A lot of times improving volume can simply occur by optimizing the skin and optimizing the loss of transepidermal water, and by improving the ultrastructure of the dermis. Firming serum, I like it. I mentioned before, I was on the pilot study that really put together a lot of the data on this, so I can vouch for this personally. Great for antioxidant, anti-inflammatory, but also, my opinion, primarily a booster of the glycosaminoglycans. Okay, now let's talk about this lady. Clearly in this picture, we see melasma. Okay, we see the melasma on the forehead, we see the melasma on the cheeks, we see the melasma pretty much all over the face. But we also see that early volume loss, right? We can see the under eye. We see more of an infraorbital hollow. We see the cheek is a little bit fallen if you look closely. I mean, in my opinion, the cheek is a little bit fallen on the lateral malar area. And again, we see a loss of volume in the nasolabial fold, and we start to see that area around the mouth, and we even see some submalar loss of volume. Okay? Now, again, let's take that lady, let's take this lady. Similar problem, different ethnicity, similar problems. We look back at this lady, my primary diagnosis, volume loss, and melasma, right? With this lady, different ethnicity, my primary diagnosis, volume loss, and melasma. Same thing, right? We can start to see similar trends in younger women. Now, her melasma, in my opinion, is a little bit more extensive. She has more involvement of the cheek. She has a little bit deeper, more dermal melasma on the forehead. So I know I'm going to have my work cut out for me. But again, similar concepts in different people, different ethnicity. So what do we do for her? Well, we utilize a protocol.
And I will be honest, we have to utilize, in this case, hydroquinone. We have to utilize the blending cream, and we have to utilize, for example, the pigment-controlled brightening cream. But we utilize the power of Rafisa here, right? We wanted to utilize some pure retin-A here. Rafisa is 0.05% retin-A. It is a prescription-grade product. It is the active form of retin-A. This gets converted to straight vitamin A inside the skin, inside the cell, and can act on a multitude of factors. So by blending this product with the blending cream, we were able to even out her tone. And by utilizing, for example, the brightening product, we were able to improve the melasma. Again, stabilizing the barrier function, decreasing inflammation, stabilizing the melanocyte, combining with hydroquinone to improve the ultrastructure of the chin, the face, the cheeks, the forehead. We were able to create a lot of improvement overall in this hyperpigmented melasma-laden women. Again, Rafisa, very, very powerful. Think about retinol palmitate in daily power defense, wrinkle and texture repair, advanced radical night repair, and Rafisa as all vitamin A class products, meaning retinoids, on a continuum, with their ultimate goal becoming vitamin A inside the cell. That's what you want to think about this. How you pick one or the other is just going to be determined by how extensive the damage is in your patient's and how bad their individual diagnosis is, whether it's melasma, whether it's hyperpigmentation, whether it's acne, rosacea, whatever it might be. So I want to thank everybody. I really want to thank everybody for tuning in to this webinar. I hope you found it really helpful. I tend to go into a lot of the nitty-gritty details about the science because I really believe that the science is the underlying component of the skincare. And in order to really understand the skincare, the protocols, the manner in which you're putting in, the products, the order of everything, it's really important to understand the science behind everything. Thank you again. My name is Dr. Bashey. I'm a board-certified dermatologist in Los Angeles and New York City. And you can follow me on Instagram at Dr. Bashey. And I'd love to thank the ZO team for putting this all together. Thanks so much.